hoping a lot of you out there today have heard of Stop It Now or are aware of the Stop It Now program. We've been around. This is our 30th year. We're really excited, and hopefully you will sign up on our contact list and hear about our anniversary activities. And our goal is to prevent child sexual abuse. And, you know, you mentioned just the immense contribution that Honey Faye Knott made. And she was at the back end of this as well, with our founder going into prisons, talking with folks about what could have helped, what could have prevented this. And, you know, we really, in many ways, we, I hope not too egotistically, but feel that Stop It Now was a pioneer in really talking about prevention before it happens, and to really think about what adults can do to be responsible and accountable to keep kids safe. While we know that kids need good education, need good resources, adults really need to set the tone, really need to create a safe environment. We have a number of programs to do that. Our prevention education is just everything we make available to folks on our website, tip sheets and advisory columns, guidebooks to help folks get answers to sometimes some really difficult, embarrassing, hard, sad, all sorts of questions. Our help services is our Stop It Now helpline, where we respond to any inquiry from any person with any sort of concern about child sexual abuse in their life, from the very early stages of prevention, how can I make sure this never happens, to I've abused, is there help for me? We also offer training predominantly to youth serving organizations, and we're a member of a number of national coalitions, organizations like ATSA, the National Coalition to Prevent Child Sexual Abuse, all working together to really advocate for funding and for policies related to primary prevention. Now, I just want to say that I almost sometimes feel like doing this presentation or starting to talk about our new WhatsOK program. We are not shifting our prevention lens away from adults, but what we do know is that kids more and more, and this is where I begin to, I think, really show my age. You know, I don't know if I could have said this 15 years ago, but as kids' exposure, access to the worldwide world, right, the web world, they have more engagement, which with more engagement comes more responsibility. They have more questions. They are seeing more things modeled for them that they want to try, and they are asking for help. So with that, we really recognized from many different places that there needs to be a resource for young people to ask about what's going on for them. I mean, we know that child-to-child sexual harmful behaviors is there, it's happening. We didn't used to talk about it as much. When we thought about child sexual abuse, we thought about, you know, the adult perpetrator, the pedophile. And as we begin to understand sexual violence prevention, we know that we really need to address children's early sexual behaviors, even those that are curiosity driven. How can we make sure that we're modeling safe behaviors, making sure that they have the information? You know, kids are reporting that they are involved in all sorts of behaviors, including their own self-involved sexual perpetration behaviors. And at the same time, they're trying to figure out who are we and where do I get that information? How do I figure out what I'm into? How do I figure out what other people are going to think of me if I'm into this? And there's not a lot of resources for them. There's just not a lot of places to ask these questions. You know, in Massachusetts, just a couple of years ago, Mass made the bold decision to decriminalize sexual behaviors in children under the age of 12. And that is so awesome. And what we know is now we've got a lot of professionals, practitioners, folks that work with youth wondering, what can I offer them? What are the resources to help support them? And, you know, I was really thinking about why we do this meeting and need, and my background is as a clinician. I'm a licensed mental health clinician here in Massachusetts, working with at-risk youth for, I guess, a really long time. And what I know from working with folks who are both survivors, folks with lived experience of sexual harm in their life, and with adolescents, is that there's a lot of things that people want to know, ask, that they're afraid to say, here's what my question is. if I did this, what does that mean about me? How do I get information about this without worrying that it's going to label them for life? And